Hi, everyone. My name is Sarah Denny. I am a general pediatrician here in Columbus, Ohio, and I've been really involved in the Ohio AAP's initiatives around injury prevention. So I really appreciate you taking the time to learn more about how we can keep kids safe around firearms. And I hope you will join us for all the modules. This one's just an introduction to kind of lay the groundwork for why this is an issue, how this Store It Safe program came to be developed. And then we have subsequent modules, one on specifically young children and them gaining access to firearms. And then we also have a separate module on teens and how you talk to teens as a parent, as a provider, or as a teen if you have a friend that you're concerned about. So I would encourage you to view all of those modules. All right, so let's get started. I don't have any conflicts of interest to disclose. So we're going to talk a bit about what the epidemiology is of firearm injuries in the United States, and why do we as pediatricians need to even be talking about it, and why is it important? And then, like I said, we'll talk about the Store It Safe program. So when we're talking about leading cause of death in the United States, if you've ever attended any injury prevention talk at all, you've seen this slide before because it is such a significant problem. We really talk about how unintentional injury is the public health crisis that no one talks about. It kills more kids than anything else. And even when we look at suicide and homicide, those unintentional injuries are the leading cause of death. And the thing about unintentional injuries is most of them are preventable. So we need to do our part as healthcare providers in educating families on what are the leading causes of death in this particular age group and how can we prevent them. So injury prevention is a really important part of anticipatory guidance. This is a really nice chart that really talks about firearm deaths in other developed countries by intent. So you can see that, first of all, the United States has the most firearm deaths compared significantly more than any other countries. But when we look at intent, you can see that unintentional there in the orange right here is a small portion, but definitely larger than in any of the other countries. So that's a large part of what Store It Safe is trying to get at. And then we're also trying to work on this suicide number in our teen version of Store It Safe. So we know that when we compare the United States to other countries, that US children who are less than 15 are 17 times more likely to be the victim of a gun homicide. We know they're 9 times more likely to die from accidental gun injury, and they're 10 times more likely to die of suicide by gun. So this is a really big problem in the United States for our children. Firearm-related deaths are the third leading cause of death in children ages 1 through 17. So we're just going to kind of pause for a minute just to make sure everyone's paying attention. And I'll give you a minute to think about this. What is the leading cause of death in children 1 to 24? Is it suicide, homicide, unintentional injury, malignant neoplasms, or congenital anomalies? Okay, so if you chose unintentional injuries, you are correct. Remember this graphic from before. All of these are unintentional injuries, the leading cause of death, actually up to the age of 44. But since those aren't kids, I didn't include it in this. Okay, so, a lot of time we talk in the exam room, and often I wonder, does this even work? Are they even listening to me? Is this even going to change behaviors? But these are 2 studies. One was published in the Archives of Pediatric and Adolescent Medicine, the other in American Academic Adolescent Psychiatry. And they were looking at counseling about firearms and whether or not it actually worked. So one of the studies was done in pediatric practices, and they did counseling by the pediatrician. And what they found was there's a 62% improved storage of the firearm within the home. So there wasn't any significant change in guns being actually removed from the home, but they were stored more safely compared to 27% in the control population. When we do something similar in the pediatric ER setting where there's counseling by the physician, 63% had behavior change. But in the control population, there was no behavior change at all with regards to safe gun storage. So we do know that it's effective, and we know that if you talk about it, you can create that behavior change. So what we're hoping with these learning modules is that you become more comfortable in talking about safe firearm storage. So what is the reality? We know that kids are living in environments containing a firearm. And if they're not living in the environment, they're often visiting or playing in an environment where there's a firearm. So maybe it's the babysitter, maybe it's grandma, maybe it's their friend's house. We know that kids as young as 3 years of age have the ability to pull that trigger. So it's important to start having these conversations with families when their kids are young. As we know, with all things injury, little kids are curious, big kids are impulsive. So we need to make sure that we're doing everything we can to keep these kids safe. When we look at the data, we use the behavioral risk factor surveillance system to get an idea of how prevalent gun ownership is. I'd be willing to bet that this is probably an underestimation, but we think that over half of all homes have a firearm, and this accounts for more than 200 million guns in the United States, the majority of which are handguns. And this also varies on location. So we know in the more rural areas, there's more long guns than handguns. So definitely you would need to tailor your anticipatory guidance based on the trends in your area. Ohio specifically, in the behavior risk factor surveillance system, 37% of the households who were surveyed reported owning a firearm. But of those people, only 46% reported that their gun was, 46% reported that their gun was in an unlocked location. So that's a pretty significant number of guns that are being left unlocked and available for access. When we're talking about risk from gun deaths, we know that boys make up 82% of all firearm deaths. For homicide deaths related to firearms, African-American children are 10 times more likely than white or Asian children to die of gun-related homicide. And for suicide, white and American Indian youth have the highest risk of gun-related suicide deaths. So, what do parents want to know from us? They've done surveys. This is one that was done by a group of physicians who wanted to know about parental misconceptions around firearms. And we'll talk a little bit more about what they found out in a few minutes. But the bottom line was that parents really do want to know about firearm safety from their pediatrician. And they want to know, when should they start talking about firearm safety? How should they do it? And how do parents discuss firearm safety with the parents of their child's friends? So if the child's going over to play at someone else's house, how do you bring up that conversation? So I think, we're going to get into how to have those conversations in a few minutes, but when we're talking about the age, it's really never too early to start having that conversation, because you don't want to wait until it's becoming an issue to have the conversation. You want families to have a plan. So if they have an infant and there's a firearm in the house, have a plan established before that child's walking and able to pull the trigger. And then we'll talk a little bit more about how to have those discussions in a few minutes. So when we started talking, members of the Ohio AAP, we were talking about how the different national organizations had obviously very opposing viewpoints. So the AAP policy statement says that the best way to keep your child safe from injury or death from guns is to never have a gun in the home. Do not purchase a gun, especially a handgun, and remove all guns present in the home. On the opposing side, the NRA has been talking, or this is a quote from one of their news articles, that the AAP has been under the control of social justice warriors who believe deeply in the nanny state in general and gun prohibition in particular. This was an article talking about why do we ask about gun ownership during our anticipatory guidance. Some other organizations that may not be as well known, Doctors for Responsible Gun Ownerships said doctors should not routinely ask patients about guns in their homes. And then on the other hand, we have the Children's Defense Fund, and you may not be able to see the fine point, but it says, by your child's first year, she can squeeze your finger with 7 pounds of pressure, approximately the same amount of pressure needed to squeeze the trigger of a gun. So we have all these different organizations saying all different things. And, one of the basics of advocacy and partnership is coming up with some common ground. And so we decided that we as an organization at the Ohio AAP wanted to try and develop a partnership with representatives from all different organizations to see if we could come up with some sort of common ground that we could launch a campaign all together that would be powerful and to decrease the incidence of accidental firearm deaths as well as suicide by firearm. So we're going to just quickly ask another question here just to make sure everyone is still with us. Who is at greatest risk for homicide by firearm? African American male, a white male, an American Indian male, an African American female, or an American Indian female? So yes, it was African American male. If you remember, they have 10 times the rate of risk of homicide by firearm compared to white or Asian youth. Okay, so we sat down as a small planning group and thought, well, who do we need to bring together? And we just started brainstorming a list of all different organizations who had some sort of investment in firearms. So whether it's in the safety of children or gun ownership, we had invited law enforcement, concealed carry instructors, Buckeye Firearms, military, pediatricians who are gun owners, pediatricians who were not gun owners. And we just said, let's try and bring everyone together and just have a conversation and see where it goes. So that was kind of when we set out on this journey. And what we decided was that we were wanting to come together and talk in a non-divisive way around gun safety. We didn't want it to be an argument. We just wanted to have a productive conversation and then try and come up with some messaging that we could all use throughout the state to promote safety. So this is something I could say in the pediatrician's office and the gun retailer could say when at the point of sale, and we would all be saying the same thing to add power to our message. What we really wanted to address to start with was unintentional firearm related injuries and deaths in young children, and then suicide of teens due to firearms. So we really kind of established these goals at the very, very beginning of our very first meeting, and wanted to be clear that we were not talking about the removal of guns from homes, the creation of a gun registry. And at this point, we're not talking about gang violence or mental health issues. Not that those aren't significant and important issues, but for the purpose of the first steps of this partnership, we were not going to focus on those areas. And so what came from it was an incredibly productive dialogue and a long-lasting partnership that has been in place for a few years now. We've been really excited to have these organizations on board, and from these conversations, we learned a lot. The first thing we learned was that in general, there's some distrust of the medical community, especially among gun owners. They sometimes feel judged on how we ask about gun ownership, as if it implies something about how they parent or the safety of their home or their family, and that there's a real fear of a registry, that the EMR is being used as a registry for gun ownerships that could subsequently be data mined if the Second Amendment were to be revoked. But the other thing that was really important that we learned is that people who have guns are open to the conversation. They want to keep their children safe, and it's all in how we approach it. And so we're going to talk a little bit about how can you approach it during a well child visit or during any interaction with a patient and their family in a way that families don't feel judged and they do feel like they can trust you and are willing to have an open conversation. And I think one of the significant things with this discussion around firearms is the AAP policy statement says, the safest home is a home without a gun. And you may feel that way as well. But the fact of the matter is that some of our families do not feel that that is true. And so we need to meet everyone where they are And if they feel like having a gun makes their home safer, then let's talk about how we can keep the child safe within that home. So, just as we talk about, do you have a pool, and then talk about pool safety, just incorporating this conversation around firearm safety into your normal safety conversation makes it fit and makes it less awkward. You're not just saying, so do you have a gun, in the middle of, a random conversation about growth and development. You're incorporating it in as you're talking about other safety things, talking about medication storage, talking about smoke detectors, water safety, car seats, poisoning, all the things that you would normally be covering, just rolling that in so that it's just a natural part of the conversation. And then the other piece is to operate under the assumption that everyone has a firearm, and frame your discussion that way. So instead of saying something like, do you own a gun? That automatically may put up some barriers or may make someone feel a little bit defensive. Just assuming that someone has a gun and then talking about safety in that way. So, if there's a gun in the home, are you keeping it locked up? And I always say locked up, because if you say, are you keeping it safe? What's safe for me means that it's locked up. What's safe for someone else may mean it's hidden under the mattress. So being very specific in what you're asking will help you have a more productive dialogue as well. This is, similar to what I just said. Do you have a gun versus is there a gun in the home? Is it locked up? This is similar to, when we're talking to our asthmatics and we're saying, do you miss your controller medication versus in a week's time, how frequently do you feel like you're missing your controller medication? It's a little bit more permissive, and it's demonstrating some understanding that I get that you miss your controller medication from time to time. How frequently do you think that happens? As opposed to the more accusatory, do you ever miss your controller medication? So just in how we say it, the tone of voice in which we say it, all those things matter. So if they say, yes, I have a gun and it's kept locked, then you can say, great, that's fantastic. Then talk about other places where the child may go. If they're spending time in someone else's home and there's a gun, is the gun locked up there? If they say no, then there's an opportunity to provide education. And if you have gun boxes to provide, then you can distribute a gun box at that time as well. And if they say, well, we don't have a gun, so it doesn't matter, it's still important for families to talk to children about gun safety, because we know that many homes have guns in them and the child is likely going into a home, whether the family realizes it or not, where there's a gun. And we want to make sure that kids understand how to handle themselves if they're put in that situation. So again, as you become more comfortable talking about it, I think it's going to be a much more comfortable conversation to have during the exam. And there's been a lot of talk about, am I allowed to ask about gun ownership? Yes, in every state at this time, you can ask about gun ownership. Some people may feel a little uncomfortable if you're sitting at your EMR computer screen and you're asking and they feel like you're typing that into their medical record. They may feel less comfortable. So maybe just kind of sitting back and having a safety discussion while you're not typing or making notes in the chart might make them feel a little bit more comfortable. So we've created, with the help of our partners, several resources that are available on the website. And this just has some data. This is for families of young children, some data for families. There's another one for physicians talking about how to have that conversation. So these are available for free. You may download them, print them off, and distribute them in your practice. So after we developed our messaging and developed some of these graphics, we started talking about how are we going to get this out there? And what well child visit do we start talking about this? And we had some funders come forward, the Kiwanis of Columbus, Buckeye Firearms, the Ohio AAP Foundation, all gave money to purchase gun boxes. So we thought, well, let's do a pilot and kind of figure out what this might look like. And so what we decided to do was at the 2 or 3 year well child visit to offer gun box to families. And we figured at this age, kids are mobile, they're fast, they're curious, they can climb, and they're strong enough to pull a trigger. So we thought the timing was probably good. And then whether the family took a gun box or not, we tried to survey all the families at the sites that participated in the gun box distribution program at the end of that well child visit. And so the data that we have so far from this is that 95% of the people who were surveyed said that someone talked to them about gun storage. So that was fantastic. We really appreciated our partners' involvement and commitment to this project. This was really surprising to me. Of those who answered the survey, 49% learned something new about gun safety at that visit. Now, remember, our only message is if you have a gun, store it safely. So that's pretty impressive that was new news to a significant number of people. Then we asked, did you get a gun storage box at your visit? 62% said yes, 38% said no. And then we wanted to know, what their plans were. So if they said yes, where were they planning on using it? The majority said in their home or car, right? But then some others said that they were going to give it to a friend or relative. And I'll show you a picture of the gun boxes shortly, but they have a cable so they can be secured to the frame of the car in case someone is out and about and needs to go into a facility where their guns are not allowed. Instead of them leaving the gun in the car unattended, they're able to secure it in the vehicle. For those who didn't accept a gun box, we wanted to know why they didn't. 85% said they don't own a gun or it wouldn't affect them. And then a few said it wasn't offered. And then about 2.5% thought that they wouldn't use it even if they had it. Now, these were only for handguns. So if people had long guns, then it wouldn't have been very helpful. But the other piece we really wanted to understand is, where do people want to learn about gun safety? Do they trust us when we talk about it? Do they want us to talk about it? And 48%, the majority, healthcare providers were the leading source that people wanted to hear about. And again, we want all of our groups to be saying the same message. So hopefully not only are they hearing about it in the healthcare provider's office, but they're hearing it from other organizations as well. So you're obviously engaged in the topic because you're watching this learning module, but what can you do? Well, first of all, you are welcome to go to this website and take the pledge, which just says that you want to make a commitment to reversing the trend of irreversible actions. You want to start getting involved in this movement and start talking about firearm safety during your visits, and we can help provide those tools to you. Additionally, you can watch the subsequent modules on the young children as well as the teens. So we appreciate the fact that you are involved in this. This is a really cool Store It Safe billboard that Akron Children's put up there, also promoting the Store It Safe message, and we appreciate their involvement. So these are the gun boxes. You can see that a handgun will fit very easily in there. And then these are the cables that just slip into this little notch right there and then can be secured to the frame of the car. So we've been really excited about this partnership. We're really excited that we're able to spread this message across the state and are excited to have you on board. So take the pledge and please continue watching the modules and reach out to us if you have any questions. Thank you.